Hello, and welcome. Today we're diving into a critical topic, brain aneurysms. A brain aneurysm is a bulge or ballooning in a blood vessel in the brain. Often, they go unnoticed, but when they rupture, the consequences can be devastating. Let's explore what you need to know. So, what causes these aneurysms to form? The exact cause often remains unclear, but several factors significantly increase the risk. These include high blood pressure, smoking, genetic predispositions like family history of aneurysms or certain inherited disorders such as Ehlers-Danlos syndrome or polycystic kidney disease, substance abuse, specifically the use of cocaine or amphetamines, and traumatic head injuries. Certain medical conditions such as arteriovenous malformations or coarctation of the aorta can also elevate the risk. Essentially, anything that weakens the blood vessel walls or increases pressure on them can contribute to aneurysm formation. Now, let's understand what's happening inside the brain. Brain aneurysms develop when the wall of a blood vessel weakens. This weakened area bulges outwards due to the pressure of blood flow. Over time, this bulge can grow and become increasingly thin. The danger arises when the pressure exceeds the vessel's capacity, leading to a rupture. A ruptured aneurysm releases blood into the space surrounding the brain, called the subarachnoid space. This is known as a subarachnoid hemorrhage, and it can cause significant brain damage by increasing pressure within the skull, disrupting blood supply to the brain tissue, and triggering a cascade of inflammatory responses. The leaked blood can also irritate the brain tissue and blood vessels, leading to vasospasm, a narrowing of the blood vessels that further restricts blood flow. This can result in ischemia or insufficient oxygen to the brain, leading to stroke-like symptoms. Brain aneurysms are more common than you might think. It's estimated that around 3 to 5% of the population may have a brain aneurysm. However, the vast majority remain asymptomatic and are never detected during a person's lifetime. Ruptured aneurysms are less frequent, affecting approximately 6 in 100,000 people per year. The incidence increases with age, and they are slightly more common in women than in men. Additionally, certain populations, such as those with a family history of aneurysms or specific genetic disorders, have a higher prevalence. Many brain aneurysms cause no symptoms until they rupture. However, a large unruptured aneurysm can press on surrounding brain tissue or nerves, leading to symptoms such as headaches, vision changes, a dilated pupil, numbness or weakness on one side of the face, or pain above and behind one eye. A ruptured aneurysm is a medical emergency. The hallmark symptom is a sudden, extremely severe headache, often described as the worst headache of my life. Other symptoms of a ruptured aneurysm include nausea and vomiting, a stiff neck, loss of consciousness, seizures, sensitivity to light, and sudden confusion or altered mental status. Anyone experiencing these symptoms needs immediate medical attention. Diagnosing a brain aneurysm typically involves a combination of neurological examination and imaging studies. If a ruptured aneurysm is suspected, a CT scan of the head is usually the first step to detect bleeding in the brain. If the CT scan is negative but suspicion remains high, a lumbar puncture, also known as a spinal tap, may be performed to look for blood in the cerebrospinal fluid. For visualizing the aneurysm itself, a CT angiogram (STA) or an MRI angiogram (MR) are commonly used. These imaging techniques provide detailed images of the blood vessels in the brain, allowing doctors to identify the location, size, and shape of the aneurysm. In some cases, a cerebral angiogram, also known as a digital subtraction angiography (DSA), may be performed. This involves inserting a catheter into a blood vessel, usually in the groin, and threading it up to the brain, where dye is injected to visualize the blood vessels under X-ray. This is a more invasive procedure, but provides the most detailed images. Brain aneurysms can be classified based on their size, shape, and location. Size is often categorized as small, less than 10 mm, large 10-25 mm, or giant over 25 mm. Shape can be saccular, also known as berry aneurysms, which are the most common type and resemble a sac protruding from the artery. Fusiform aneurysms are another type. They involve a widening of the entire artery. Location is another important factor, with aneurysms commonly occurring at the branching points of major arteries in the brain, such as the circle of Willis. Treatment and management of brain aneurysms depend on several factors, including whether the aneurysm has ruptured, its size and location, and the patient's overall health. For unruptured aneurysms, the decision to treat is based on the risk of rupture versus the risks of treatment. If treatment is deemed necessary, options include surgical clipping, where a metal clip is placed at the base of the aneurysm to cut off its blood supply, and endovascular coiling, where a catheter is inserted into a blood vessel and guided to the aneurysm, where coils are deployed to fill the aneurysm and prevent blood from entering. Ruptured aneurysms require immediate treatment to stop the bleeding and prevent further complications. In addition to clipping or coiling, Treatment may include medications to control blood pressure, prevent vasospasm, and manage pain. Supportive care, such as mechanical ventilation and monitoring of intracranial pressure, may also be necessary. While not all brain aneurysms are preventable, several lifestyle modifications can reduce your risk. Maintaining healthy blood pressure through diet, exercise, and medication if necessary is crucial. Quitting smoking is essential, as smoking damages blood vessels. Avoiding illicit drug use, particularly stimulants like cocaine and amphetamines, is also important. If you have a family history of aneurysms or certain genetic disorders, talk to your doctor about screening options. And wearing a helmet during activities that could lead to head trauma can help prevent aneurysms caused by injury. The prognosis for brain aneurysms varies widely, depending on whether the aneurysm has ruptured and the extent of any resulting brain damage. Unruptured aneurysms that are successfully treated have a good prognosis. However, ruptured aneurysms can have significant complications, including permanent neurological deficits, such as weakness, speech problems, or memory loss. The mortality rate for ruptured aneurysms is also substantial, with approximately 40 to 50% of people dying within the first month. Recent research is focusing on developing better diagnostic tools to detect aneurysms early, improving treatment techniques to minimize brain damage, and identifying genetic factors that contribute to aneurysm formation. One promising area of research is the development of flow diverters, which are stents that redirect blood flow away from the aneurysm, allowing it to heal. These advances are helping to improve outcomes for people with brain aneurysms and offer hope for the future. Thank you for joining us today. If you or someone you know is at risk for brain aneurysms, please consult with a healthcare professional.